explain again. Okay, so for family planning, so you have to greet the mother and the spouse, and so to introduce yourself, explain the purpose of using family planning, why you need to educate the partner to apply family planning. Okay, the purpose because we need to give space between children and also for mothers' health and also to improve their family economic, socio-economic, and also to prevent any complication, any medical problems, especially for mother and also for children, and also the bonding time. Okay, so when they space their time at least 2 years for one children, so they will have more time to that particular children. Okay, so and then you have to explain that we will have a four method of family planning, which are natural method, hormonal method, mechanical, and also surgical method. Okay, for ovulation, we will suggest to our client that who had regular period, which is 26 to 32 days cycle. Okay, so meaning that 14 days after menses, meaning um, the menses period, the period time is 7 days, and then after um, day 8 to day 20, so we have to advise our client to avoid any sexual intercourse. If they still want to have sexual intercourse, we might ask them to use a different method of family planning. For example, they can use condom. Okay, and then for mucus, we have to advise to teach our client to check the mucus if the thin is the fertile period, if the thick is post ovulation. Okay, so they have to avoid any sexual intercourse when the mucus shows thin texture. Okay, and then for temperature, they have to check regularly every day, and then they have to record. They have to record all the temperature. So for usually during fertile period, the temperature was slightly higher. Okay, slightly higher, about 0.2 darjah Celsius from vessel body temperature. Okay, and then another for natural is withdrawal. So withdrawal, we have to advise to the husband to ejaculate the semen away from vagina, so the sperm will not go into the to mix with the ovum. And then but this method, they have to have good cooperation between husband and wife. Okay, and then for breastfeeding, we can encourage mother to give breast fully and exclusive breastfeeding up to 6 months. Okay, and then during this period, the mother will not have, usually the mother will not have menses, okay, or we call amenorrhea. And then also we have to tell the client about the effectiveness of each of the method. For natural method, the effectiveness is poor. Okay, so the chances for mother to get pregnant is high. Okay, uh, and then another for hormonal, we have pill, OCP pill, oral contraceptive pills, combination of estrogen and progesterone, or we have progesterone only for breastfeeding mother. An injection they can use for every 2-3 months, and implant 3 or 5 years. but the implant is quite expensive and usually they can get from private clinic. And patch, only they can apply on the skin weekly, and then the effectiveness is very good because we take hormone to our body, and but it depends on the suitability of that particular person, because some people they are not they are not they cannot get they cannot use hormonal method, because when we take for example pill, so they will disturb their own body hormone. Okay, so that's why sometimes when people they take hormonal method, they will put on weight. They will put on weight, so we can advise them to use a different method, different other method. Okay. However, the effectiveness is very good. Okay. Okay. And then another method is a mechanical method. Mechanical method is IUCD, intrauterine contraceptive devices, condom for male, diaphragm for female, and spermicide. Okay, the effectiveness is moderate. Yeah, the effectiveness is moderate. So I think for details of the equipment, you can refer back to my notes, because in my notes also I already insert insert my voice, my all the explanation there. So you can open to your Google Classroom, then you can open the notes where I already put my video to explain each of the method. And then and last we have a surgical method. Okay, for surgical method we have two, for husband and wife. So for wife, for mothers, we have bilateral tubal ligation, BTL, or for husband, we have vasectomy. And then the effectiveness is 100%. Because the surgical method is the last choice of family planning. Okay, because we will suggest to our client when they have medical problems or they have history of cesarean. For example, 3 times as history of cesarean section. So then we will advise them, advise mother, and to discuss with husband to undergone for surgical method family planning. Okay, all the family planning, they need to have a discussion and understanding between husband and wife. Okay, and then for vasectomy, they will cut the vas efferent for male, so that the sperm will not go to the uh, to mix with the ovum. So there is no they cannot so the mother cannot pregnant. But this one is quite rare, because usually they will do BTL. The mother will sacrifice. The mother will sacrifice, and then because after that they cannot, it's the permanent. For surgical is permanent, they will not, they will no turn back. When you undergo for BTL, there's no turn back for you to get pregnant. So that's why the effectiveness is 100%. Unless it's very rare, because now they have improved. You can look at my notes. There are three cutting, and there are three incision type of incision. So they can bend, they can cut end to end the fallopian tube. Okay, so uh, so when we have explain to our clients about the method, how they can use the method, the equipment, and we have to assess their understanding. Is it they understand or not what we have teach them? Okay, so how we need to assess them? How we can assess our client? Is it they understand or not?
Repeat.
Ask client.
Ah,
Going to repeat.
okay. Yes. So you have to ask your client, okay, for example, okay, Madam Siti, are you understand? Can you explain to me? Do you have any question? So if they said no, do you understand? Yes, I understand. So can you explain to me what you have learned just now? So this is the question that we can assess, that we can ask our client to assess their level of understanding. Okay, because if they are not understand, so they will say that uh, I have learned about family planning, but why I get pregnant, right? Because we don't know that they understand or not what we have teach them. Yeah, that's why it is very important for us to ask about their level of understanding. Okay, and then we have to tell, okay, if they say, okay, I understand, okay, thank you very much, Madam Siti. And then when we talk to our client, we have to always maintain our eye contact throughout the procedure, and then the soft skill, clarity. For example, now you give health education to lay person, so you can just use the lay language that's suitable for lay person. So you don't need to teach them how the sperm to the oval, and then how the anatomy and physiological of the pregnancy. Okay, so very simple that they understand. Okay, and then last but not least, you have to document. Okay, document the health education done by you. For example, if 1 month follow up after delivery, so they still can use the pink book. There will be a column for 1 month follow up. Okay, you can write there, or you can write on the health education on the family planning book. Okay, so every time they went to the clinic, they have to take blood pressure and the vital sign, and also they need to check for urine pregnancy test, UPT. When they are negative, then only they can continue the medication. Okay, and then for uh, so you have to write down date and time. Okay, you can say that health education on family planning done by siapa? Done by student nurse Afia, for example. Okay, and then you write down the vital sign. Okay, the weight, the BP, because some of the medication for oral contraceptive pill, they might affect for blood pressure. Okay, okay, understand?
Yes.
Yes.
Okay, this class was recorded, so you can listen back, right? You can listen back, right? Okay. So any question? Any question for family planning
Oh, no.
or any other question?
Doktor,
Yeah.
kita nanti tak ada belajar pakai kondom pun tak ada kan? Practical tu.
Practical, yes. Who's
Doktor
asked
dengar
me
tak?
who asked me the question? Lutfi.
Nanti kita ada practical ke tak ada practical yang tu?
Because we don't have face to face, so how to use condom and that one I can provide the link, or you can use YouTube. If you want, I can provide the link so you can see, because condom, how to teach client to wear condom. Phone. Okay, for condom, they have to check for expiry date, and look at the expiry date, and then the condom usually a condom that provided in KK, klinik kesihatan, different from they can buy from pharmacy. Even 7-Eleven also sell the condom, right? So they have to look at the expiry date. And then for some of the condom, they have flavor. This one chocolate flavor. I don't know why they put the flavor. So some strawberry flavor. What you know? So many flavor. So this one is chocolate flavor. So you need to advise to your client to check the condom. Is there any leaking or discoloration? Yeah, the smelly chocolate. Smelly chocolate. Okay. So when you open the plastic, the condom will be like this. You can see here. Yeah?
Yes, doktor.
Okay. So the way you put, you have to ask your client to put like this to the penis, put and then roll down. So when they insert this condom to the penis and then roll down. So they will cover until base of the penis. Okay, so this, when they roll down the penis, so the condom will be like this. If not, then there will be like a ring. Where I want to put, not much thing I can do. So you can teach how you can teach to your client how to wear condom. Because previous times the nurse teach to client, and then they show by using the finger. So and then the client also use condom to the fingers, and then next month his wife become pregnant. So you know, this how is what they call failure in giving health education, proper health education. So you can look at the YouTube channel, search for using condoms. The condom is not much problems. Okay. And then for this one, the surgical, so they are banded, cauterized, and tie and cut. Okay. This previous time, I think most of the BTL they use banded. So banded sometimes the stitch will what they call
Will break.
yes. So the sperm still can enter. So now if they use cauterize or tie and cut, they will uh, no risk for sperm, no chance, no chance for sperm to enter. So that's why the effectiveness is 100%. Okay. And for injection is seems like you give IM, you give IM, the Depo-Provera. So you have to dilute. So it depends on the clinic or the dosage provided. So you give through IM route. Okay. This one for vasectomy. They will cut the vas if differential, so the sperm cannot go out. So they until here, then they will disperse like that. No, cannot enter. Okay. What else? So this diaphragm it seems like condom, but diaphragm we use to female. Okay, they have to bend. Show to you. It's like condom, but slightly bigger than condom, and they are short. They are short. Okay, for can refer to my note. So they will like bend. The diaphragm is like this, round, like ring, and then they will bend like this, and then they will insert into vagina, and then cervix to then there will be placed like here. So they cannot the sperm cannot enter. It's like a male condom. Sometimes they call male condom, the diaphragm. Okay. Okay. Any question? Oh, The diaphragm usually for, it's like condom. Okay, it's like condom. They, when they want to do sexual intercourse, they can insert. Then after that, they have to throw away like condom. Okay. So I need to teach. Okay, Afia asked about berapa jarak Israel untuk mengandung. So usually we will advise to have 2 years gap between children, and then but if they have a history of cesarean section, usually for government hospital they only allow for three kids, and then they have to undergo for BTL. Because if not they will have high risk to get pregnant, and then they will they might have risk for uterus rupture, okay, because of cesarean. Okay.
The side effect of the BTL and so on tu, dia akan dapat symptoms menopause tu ke?
Actually, I think so far there is no research mentioned that for those who undergone for BTL will get menopause early compared to who do not do BTL. So there is no evidence saying that. So only they can for BTL is there is no side effect, like you just
So dia akan menses like usual lah every month.
yes they will having menses like usual. It's not same like when patient use hormonal, they might affect their menses. For example, implant. Some people they use implant, and then they will not have any menses for 6 months. So in 6 months times only they will having one menses. So they might disturb the hormone in our body. But it depends. Some people they don't have any complication or reaction to the hormonal taken for family planning. Some of client they might put on weight. If they take pills, the hormone they might put on weight. So it depends on that's why sometimes that's why we cannot say that okay you have to take this method. Okay, we have to give, and then also the client also have to try. For example, they take Depo-Provera for 2 months. After 2 months, and then she said that she cannot tolerate. Because because for the follow up, we will monitor. We will do observation for every patient. So if we found that the weight drastically increase, so we might advise to change another method. Because and also for pills, they need to have commitment. Every day they have to take the pills. Okay. For example, where's my pill? because 4 pills, they have combination of progestin only for they in look if you look at my notes, the tablet will have arrow, arrow. So you have to advise to the client to take 1 pill, follow the arrow, one pill per day. Okay, so if she forgot to take yesterday, so now today she said, oh, I forgot to take my pill yesterday pill, so she can take double dose. Okay, at least three days. But if more than 3 days, so we have to advise to continue pill, plus they have to use another method of family planning. For example, they must use they can take the pill with condom. Is condom. Then after that, anti-complete, after complete, then we will follow up and then we check for UPT, because we worried that during the missing tab, they have sexual intercourse, that they might get pregnant. Okay, because usually we will advise to back up with condom or diaphragm. Okay, because every time they need to continue the pills or the injection, they must check for UPT. Okay, for example, let's say that they forgot for 3 days, we cannot we cannot change to injection, because we have to wait until she got menses, or we need to check for UPT. Because usually in 14 days only we can identify that the client is pregnant or not, right? So it's not like today she has sexual intercourse, then tomorrow we can check is it they are pregnant or not, right? So we have to wait for 14 days to know. That's why usually if they forgot to take the pills, we will ask to back up with a condom. Okay. Okay. Any other question?
Doktor, during menses pun kena ambil pil tu ke?
Dia ada, yes, they will have this one 28. Okay, this one 28 pill, so you, because 28 and then plus they will take pills, 28 pills, then they will stop period for, let's say, 7 days. If 20, so it will be 35, right? So then they will continue. After menses, they will continue another pack. So they will stop. They suppose finish before menses.
Before. Stop before. Kiranya menses tak payah ambil lah.
So they will take 28 pills. They will stop for 7 days for menses, then they will continue back. So for 28 pills.
Yang
28,
macam
28 days.
kiranya yang macam tadi yang doktor kata kalau dia ada missing dose in between dia makan tu, so dia akan start over after dia clear menses, 7 days menses tu lah. Tak.
For example, they have now 28, 20, let's say they forgot to take on the day 25. So they have another 3 left, right? So okay, for example, yesterday forgot. So today is 26 days. She can take 2 pills. Today, she can take today pills and yesterday pills. So 2 pills for today, and then continue as usual.
Sampai menses. Tu
Yes.
kalau yang dia missing like less than 3 days. Kalau yang more than 3 days tadi doktor kata sebab
They
kita
have
tak
to
boleh nak
stop.
betul.
They
Stop.
have to stop,
Right
and then
away.
they can use condom.
Oh, kiranya after menses yang tu
No.
baru dia start balik. Ke memang dah tak
Yes, they can.
efficient lah benda ni.
So let's say they forgot 5 days. So we advise to stop pills. They can continue with condom until the next. Suppose they finish, then they have menses. So the next follow up to take new pill. Then only she can continue with pill. So during follow up, we will check the UPT. If she's not pregnant, so we will continue the pill. Because we worried that if 5 days she missing, and at the same time she had sexual intercourse, right? So because during that 5 days she's not under any protection, so we worry that during this they will get pregnant. Because during these 5 days we cannot, we don't know yet whether she's pregnant or not, right? So after the next menses, if she's not having menses, or we check the UPT, so if not pregnant, so they can continue. If not, if she's pregnant, so it's not effective family planning. Okay?
Betul.
Doktor. Okay, Lutfi tanya dulu.
Apa ni, kalau macam kondom kan ada yang free kan. Tapi kalau macam ubat yang kontraseptif ni given free daripada klinik ke tak?
Yes, free.
Free juga.
Condom free, pill also free. Only I think for IUCD and implant they have to pay.
Surgery?
For intrauterine contraceptive device, IUCD, and implant, they have to pay.
Kalau surgery tak ke?
Or surgery also, because surgery they usually undergo in the hospital.
Oh, okay. Okay.
So surgery in the hospital is like usual charges lah. They have to admit usually one day they admit, and then tomorrow they will do the BTL, then can discharge. So the charge will be same like surgery, but it's not expensive. If we done this in government hospital.
Doctor, I have questions. Like macam Western teenagers kan, after they having sex like that, macam like they have macam morning pills, morning after pills. Kira dia makan to prevent from getting pregnant. So that is the same as OCP or not?
Yeah, actually, that one usually we give to rep victim, because we don't want they get pregnant unintentionally, but the dose is very high, and we can take the dose only 4 dose per month. But it's not considered as family planning pills. Okay, it's not considered as a family planning, but that one is to prevent.
There is other medications lah. Ke sama tablet ni?
Different. The concentration, the content is different because high dose. That's why we can take 4 times. For example, let's say that the husband is not around. Okay, for example, the husband just at home for 1 week, for example, for 1 week per month. So the wife can use that morning pill if they can have, but they can only have 4 times sexual intercourse. For example, after sexual intercourse, they can take the pill, and immediately after sexual intercourse, they can take the pill for only 4 times. If they want to do sexual intercourse more than 4 times on that month, she need to apply another method, for example, condom.
The
Or
the effectiveness of the morning pills tu high chance juga to prevent pregnancy lah.
Yeah.
Because of the higher dosage. Okay, understood.
Because usually for rat victim, we give the pill. And then the pill actually, we cannot take as a family planning because the high dose, and they will affect our other medical condition. Okay. Okay. Any other question?
Doktor, kalau macam yang hair edu tu, kita kena bagi dekat wife dia je ke, or sekali dengan partner dia?
Okay.
And kalau macam contohnya, tugas kita ke as a nurse untuk educate partner diorang yang macam diorang tak boleh terima family planning tu.
Yeah. Because, okay, usually in our KK, family planning is very rare to see that a husband accompany his wife in Malaysia setting. So, but some of the client, they will come together. So when they come together, we can call them, both of them, and then we give health education to both of them. Okay, and if they refuse to have family planning, is also our responsibility, our nursing roles to educate why they need family planning. Because they might say that all rezeki from Allah Subhanahu Wa Taala. So it doesn't matter if they have 10 children also, there must be a rezeki for each of the children. Yes, because but we have to explain properly why. Not just for rezeki to the children, but also for help to the mother, to the family, other family members, so they might understand. Okay, Shamira?
Kira-kira.
Doktor,
Betul.
saya ada soalan.
Yes, look.
Kan ada apa ni yang macam pregnant woman woman yang ambil implant tu tapi tak beritahu husband dia. Ethical issue macam ni kita juga kena handle.
Usually they will have agreement lah. Agreement between husband and wife, but sometimes they might have reason. So for example, the husband not agree to apply family planning, but the wife, because the wife will facing all the problems to get pregnant, to raise up the children, right? So I think the one is sometimes if they like they are fighting each other is beyond our control. It's beyond our control and it's not our responsibility lah. But our responsibility is to educate them, to make them understand. Oh, it seems like immunization. We educate them, we make them understand why they need the immunization, but they refuse. So when they refuse, for example, we need to refer lah. Because there is issue also saying that for family planning, wife, they have right to choose, they have right to have family planning because their own body. Lutfi?
Yeah.
Okay. So that's why sometimes it's beyond our control when argument between husband and wife.
Okay, Doctor. Thank you.
So please scan the QR code given to you previous to as an attendant for this session. So we use the same QR code. Okay, any question?
Not yet.
Okay. Any other question, or you can always text me or okay. So I think for my part, I think I have finished. Because before PKP we have we have a class on environmental health, right? So only I left 2 special population and social problems, and also for health education, family planning on health education. So I think I have finished all my class. So I hope that you can read through my notes, and if you have any problems, you can always text me privately, so that I more alert, because sometimes in the group I'm not they are not alert because so many message coming in. So I'm not sure when you can be here. So
Untuk OSCE subjek ni yang health education tadi tu je lah.
mungkin kot.
Ya tu.
Because we might ask any other health education.
Untuk subjek doktor yang health education family planning ni lah.
For OSCE, we might have other session. Maybe immunization, maybe health education, maybe geriatric assessment, all the practical session can be OSCE question. But I don't know when we can do the OSCE because you are aware, right? Maybe for MCQ, MEQ, maybe we can proceed. I'm not sure. We have to wait for MKN and the University Authority to instruct when you can come back to campus. So are you missing kuliah of nursing or not?
Yes.
Or you are very happy at home?
Rindu doktor.
Right. Because okay. So any other question? Because I have
Saya nak tanya.
immunization. Yes, Rajesh Ami.
Yang apa tu assignment tu, yang written report tu kan doktor kata ikut rubrik reflective writing tu. Maknanya report tu kena tulis, kena jawab soalan yang tu ke ataupun point yang kita orang punya?
Come again. Assignment.
Apa sebabnya dalam rubrik tu dia tanya soalan, yang report tu dia tanya soalan.
Oh, tak, you can
Report kita orang tu kena jawab soalan.
reflective. Follow the guideline lah. Follow the guideline on the rubric. So they might ask you about your experience Your experience. Do you have the ni? Wait, I look at the rubric. The rubric for what? For reflective.
Reflective.
Okay. So for rubric reflective, okay, describe the session or activity, event or experience kan. What did this session or activity make you feel? Okay, so you just write down this, answer according to the form, but they must be 5,000 words. So it's about 10 to 15 pages. So for example, this form, wait, I look at the For example, this form, as you think of recent session or activity or experience. So, what you have learned. For example, in your case, you will prepare presentation, right? On the special population, social problems and non-communicable disease, right? And communicable disease, right?
Yes.
So it follow what you are assigned for. What did this session or activity, because previous you're supposed to go to Felda to do the community service, right? But now cannot, so you have to have the session that you give health education. So you might stress on visual medium. For example, what did this session or activity event experience make you feel? Okay, you might say that for this session we conducted health education or conducted a talk or seminar using what kind of platform, because of apa experience you, what is your experience now. So due to a pandemic COVID, but we still need to we still can conduct the event but in the different. So what is your experience doing this? So maybe you will say that is a good experience for you to learn new medium in giving health education, in giving in educate client. But the contra, you might have problems in terms of internet connection, internet access, something like that. Okay. Then what would you want to change? Okay. So what has this experience has taught you? So what you have learned? What you have learned in preparing your task during this period of time, during this MCO period, because it's a big challenge. It's a big challenge for you and also for us. Okay. Any other question? So you can text me, you can email me, or you can go to our Google Classroom. So then you can also go to our iTalim. All right. Okay. If there is no other questions, so we will end our class. And then our Friday class also, we don't have Friday class, because now we have the tutorial. So okay. Is it okay?
Okay.
Okay.
Okay, so don't forget to
don't forget to upload the recorded session in the classroom.
Okay, sure.
Alright.
So don't forget to scan your QR code as attendance to this class. Okay, thank you very much. Assalamualaikum. We'll see you. Take care. Bye.
Thank you, Doctor.
Thank you, Doctor. Take care.
Thank you, Doktor.
Okay, bye.
Bye.